Hello, everyone. Today is March 8th of 2022, and I'm here with Mackenzie Moore. And Mackenzie, I'll pass it over to you. If you could introduce yourself, tell us a little bit about your background and your job at the center.
Sure. So I'm a research associate at the Center for Global Health Science and Security. I first joined the center when I was a grad student at Georgetown, which I started my program right before the pandemic and finished it during the pandemic. So we can talk about that later. I work on a bunch of different projects at the center around capturing COVID policies, building evidence libraries, and collaborating with other people at the center on the outbreak activity library. So my undergraduate was in medical anthropology. I always knew I wanted to kind of straddle the space between medicine and the programmatic side and more of the policy and research side. So after doing medical anthropology, I went on, worked at the Global Fund for a bit and decided I wanted to go back and get my master's. So went into the Master of Science in Global Health program at Georgetown University, where I was specializing in disease control and prevention. And this was fall of 2019. So right before the pandemic.
Yeah, interesting. Okay, so then kind of, looking back to 2019, when did you then begin your role at the center, and how has your work at the center at all shifted given the spread of COVID-19, starting in the spring of 2020 and onwards?
Mm-hmm. So I first started working at the center in January of 2020 as a GHI, which is the Global Health Initiative Fellow. So I started as a fellow, which is a semester-long program for undergrad and grad students at Georgetown. So I was working with Rebecca, was my mentor at the center, and I was assigned to the Goal Project. So during my GHI fellowship, I worked strictly with Goal. Pre really the pandemic starting out, and then the first couple months. Once the GHI fellowship was over, I joined the center as a graduate research assistant, and that's when I really started doing more COVID work, where I think I saw a larger shift at the center away from some of these longer term projects like Goal into more COVID specific work. So I joined in working with AMPS, capturing some of these early policies. The project that I started out in, May of 2020 was a big contact tracing initiative where I and two undergrad students started capturing every state and some of and I think the 10 largest city health municipalities in the country, what contact tracing data that they were publishing, what metrics they were using, how are they comparable, what was the level of transparency in data that they were publishing. So that was probably the biggest COVID project that I was involved in at the center. We captured data for 12 months on that, and that tied back to when I finished my master's program in December 2020. So that whole year I was working as a graduate student researcher, was mostly focusing on contact tracing, and my graduate student thesis ended up being on contact tracing, but at the global level, looking at similar metrics of what are countries publishing, what are their contact tracing workforces, who are they pulling from, are they trained public health professionals, is it volunteer, what type of transparency, what's the governance processes around contact tracing, how early did they start, is it something they're still doing? So mostly contact tracing work for COVID in 2020.
Yeah, amazing. And then, kind of looking beyond 2020, and also given that there have been many waves of the pandemic, could you speak a little bit about how your work might have kind of been involved with the different ups and downs of COVID-19?
Mm-hmm. What comes to mind is the Omicron sprint that we did of capturing travel policies. I think there's so many different parts of COVID that the center as a whole has been tracking, whether it's the caseload epi side, whether it's the different policies, and then of course within the policies, there's so many different categories of policies that come up. and looking specifically at travel policies, I think those are the ones that interested me the most. And I really enjoyed that particular project. Of as soon as Omicron was announced as a variant of concern, and you saw that chain reaction of countries starting to shut down borders to different countries, looking at policy versus reality of caseload, of who had genetically sequenced and proved that there was the Omicron variant versus which countries were being banned, I thought was a really interesting project.
Yes, super interesting. So kind of looking at across all of your research and work that you've done involving COVID-19, are there any kind of larger takeaways or particular moments that you found very interesting, or also maybe if you could speak more about like the target audience of, who this research should benefit?
Sure. Um, Another one of the projects that I worked on was the FETP project at the center, which is the Field Epidemiology Training Program of I and a couple of other people at the center were designing case studies and exercises for people who are in this FETP training course, and they were centered around what was really happening in COVID and would be used by trainees in the different countries where these programs were piloted and will eventually be used to address COVID. But then we're always thinking about what's the next outbreak, what's the next pandemic. So I think that was particularly interesting to me because it's thinking about how can we take very rapidly the lessons that we've learned in the last 18 months or so from COVID. How can we apply that to COVID as it's ongoing, but also how can we think about the progress that we've made in strengthening health systems during these like rapid periods of building up. How can that be used and maintained? Because we don't want after COVID's over to kind of see a big drop off in commitments to public health. So I think that's interesting. Another one being repurposing of existing health systems. That was something that I looked into a lot with my contact tracing project, and we did with this of how different countries and regions have repurposed their existing health systems, especially disease specific things like polio, like tuberculosis, to address COVID. So really thinking like big picture, long term, how can we take things that we already have? How can we take things that we've built during COVID? How can we roll them together and keep them going for the future for different pandemics? In terms of different target audiences that the center work impacts, I think that's been one of the really interesting things. And so the audience is huge. I mean, we work with government officials who are actually making and implementing the policies. We're working with other research centers to collaborate on their research efforts. We're working with people who are actually in the field doing epidemiology, doing medicine, doing logistics, rollouts of supplies. So I think it's such a wide range of people, and the like general public, people who don't necessarily have public health or epi backgrounds coming in and using center resources to learn about something. I mean, I think at this point, everyone in the world knows what an epi curve is.
Yeah. Well, kind of thinking ahead, what comes next for you and also for your work, looking ahead to the next 6 months and also kind of, further down the road from that.
I'd really love to do something non-COVID. We'll see how possible that is. But I think really leaning into that, how do we bridge past our experience with past diseases and what we've learned with COVID into kind of circling back into these diseases that are still very important. I mean, I got into my master's program wanting to specialize in tuberculosis programs. It's something that I'm hoping to return to. I feel like I can't say post-COVID because we don't know when post-COVID will be. So still during COVID, finding that overlap of making sure that we recognize, yeah, we're still in the middle of a pandemic, but that doesn't mean that all of the other diseases kind of back off. If anything, I think efforts towards neglected tropical disease programs, tuberculosis, polio, HIV, have been fairly neglected for the past 2 years. And I think there's going to be a concerted effort to within the public health community to return to that and recognize where gaps may be. So I'd like to be part of that. The other thing that I've really enjoyed that I'd like to continue in the next couple months, couple years is the application of data and data science to policy is something that I've started to do during the center that I've found very interesting.
Yeah, well, thank you so much for your time today, Mackenzie. Your work has been so important at the center, and all your contributions are amazing, especially those that kind of shifted to target COVID-19. So thank you so much for your time today.
Thanks, Emily.